Hi everybody, it's Dr. Cary Yurkiw here. Thank you for joining me this morning as I talk about sports injuries and how that can affect the head and neck area. Sports injuries are something we see all the time in the clinic, whether it's playing hockey and you collide with another player, or maybe you hit the boards head first or into a post. You know, I'm familiar with all those things because I played a lot of hockey. They do happen, and I know I had quite a few head and neck injuries playing hockey as a teenager. And then there's other types of sports injuries. Let's say you're mountain biking or road biking, you fall off your bike, you hit your head and neck, or sometimes it's the neck on the side and the shoulder, and it kind of separates the two. There's different types of injuries that we see in the clinic, and so today I'm going to talk about that. Even sports like volleyball. My kids played a lot of volleyball, and you'd be surprised at how many balls hit the side of the head of the player or on top of the head, and that can cause things like a concussion. So we're going to talk about those things today at this webinar. So thanks for joining me. I really appreciate it. And I'm going to switch over to my slides here on YouTube Live, on Instagram. You'll just have to follow me here, but you're certainly welcome to go over to YouTube and subscribe to our channel, and you'll get notified of these free webinars. Usually we do this on Monday, Wednesday, and Friday. So today we're talking about sports injuries, and I'm Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna, British Columbia, and I've been practicing for 29 years now, and I am accepting new patients. If you're in the area and if you do have a sports injury or head and neck injury, please feel free to contact me and I'd be happy to help you. If you're not in the area, please DM me or comment in the show notes, and then I'd be happy to refer you to somebody in your area that can help you. So sports injuries can be a result of a collision, player to player, and that kind of works like whiplash, like a car accident, where you hit the player from the front or the side and it causes a whipping motion of the head and neck. The head being a lot heavier than the neck, so what can happen is you can get kind of injury between the bones, the discs, the ligaments, and this can result in misalignments, what we call subluxations in the clinic. Falls can do the same thing, but the mechanism of a fall is different. When you fall off a bike, let's say you land on your head or your side, there's a downward force and a separation of the head and the shoulder. So we can see some brachial injuries, the brachial nerve in the lower neck going down the arm, and often that can cause referred pain down your arm because the nerves are injured in that area. And then concussions, that's another major concern is, when you have an injury to the neck area, it can also cause concussions where there's a hit to the head, the brain inside is soft and it's fluid filled, and there's a lot of compression that happens in the brain, and that compression can cause injury to a certain area of the brain, or even like a bruise or contusion type of scenario. And so I wrote about that in this book called Neck Pain, and in there I included headaches, whiplash, and concussions in the book. So if you want to get that book, you can certainly get that on Amazon. I'll put a link in the show notes below, and feel free to go to that link and to go to Amazon, and you can get that in audiobook, ebook, or paperback format. So when somebody comes into the clinic, what do? The first thing we do is a history. We want to understand the mechanism of the injury well. History is very important to properly diagnose a condition. Then we want to do the examination. So we want to find out what the alignment's like, the posture, ranges of motion, do some orthopedic neurologic tests to determine what the cause of it is. And then, and then our diagnostics. So any other tests like digital x-rays that we have in the clinic to diagnose what the cause of the problem is. Once we do that, we have a diagnosis that I explain to my patients, and then a differential diagnosis, meaning what else it could be, so a plan B. And then we talk to the patient, get consent to do treatment, and then the treatments begin. I do videos for my patients much like this to explain to the patient their particular condition. So patients in the clinic really like getting a personalized video because it explains their exact condition and what can be done to help. The services I offer in the clinic are chiropractic care, similar to hands-on adjusting, as well as instrument adjusting, and then I use tables to do adjustments as well. So these are manual adjustments, instrument and table adjustments. And then I do x-ray. We have digital x-ray in the clinic. We have shockwave, which is a mechanical instrument that sends impulses into the body to help stimulate and treat the tissue. Lasers, this much the same purpose, but it's a soft laser, a light that goes into the body. There's no force, but it's a light wave that goes into the body to help stimulate healing of the tissue. And we use decompression and traction techniques to help heal compressed joints and injured areas, especially in the upper cervical area. I find traction and decompression works the best. So I want to thank you for joining me today. If you have any questions, please feel free to DM me or write in the comments. And I'd be happy to help you. If you're not in the area, refer you to a chiropractor in your area that can help you. If you are in the area, usually we can see new patients somewhere around in the 24 to 48 hour range and get you some relief, and then also work with you to correct the cause of your pain and discomfort. So I look forward to talking to you guys. Please subscribe to our YouTube channel and our podcast. It's widely distributed on Apple, Spotify, and Google. And then please follow me here on social media. I'm on Instagram, Twitter, and Facebook. You can always join our Facebook page for the clinic as well. And a lot of times the recordings of these videos will be uploaded or the link shared on social media. So if you miss something, you can always go back and watch that. So again, thanks for joining me today. Have a wonderful day, and I'll talk to you guys on Monday.